We know that people with a learning disability who are in assessment and treatment units and specialist hospitals I do not always get a good healthcare. The serious case review into abuse at Winterbourne View assured that lots of health problems were ignored and people did not get the right treatment for their physical illnesses. People such as Conor Sparrowhawk have died, and his death could have been avoided if he had received the right care and treatment.
Hi. Just want to let everyone know this is question time. Okay.
Okay. We know that some type of physical restraint can be very dangerous, that people can die as a result of being sustained, but it is still being used in too much hospitals, such as Calderstones.
Hi, Derek. What are you going to do to make sure that people who are in ATMA care and support use and support hospitals get the right health care support and support for the people health needs?
So that's the first question for the panel. Oh.
How would you make sure that people are safe and well looked after when they are in assessment and treatment units and hospitals that unsafe forms of restraint are spotted and stopped quickly? What should health and social care commissioners be doing? What should the police be doing?
Okay, so that's a couple of questions there for the panel to answer.
Can you hear me, conference? Yeah. If I start and respond to the question was around people getting the same treatment, both in terms of their physical needs when they're in specialist hospitals or assessment and treatment units. So the fundamental right of somebody, whether they're in hospital or whether they're in a specialist unit, is to continue to have the same level of support that they would expect if they were at home or living somewhere else. Now, if it is the case that there is a rule that says that the commissioning of those services is different, so for example, the GP can't go in because it's not your local GP, or if it is your local GP, they should be able to come and support you, then we need to overcome some of those things, because people have the same rights, whether they're in hospital or in assessment and treatment units, as they do when they're back home. The other thing that struck me was that there was something people talked about getting treated fairly, and we have Care Quality Commission, and I noticed earlier this morning that Care Quality Commission wanted to be here but weren't able to be here, and I'm sure if they were here they would say that even though they do assessments, they're only as good as the day that they walk in and walk out, and quite often it isn't always the case that they find everything that is happening within there. And I go back to the point I made earlier around the way in which we develop the people that care for people in assessment and treatment units or in hospital or indeed in the community have to have the right skills and the right values. When I recruit people to my organisation, I recruit on the values that those people have. I work on the basis that we can train people and give them the right skills, but if they've got the right values, and that's what we didn't see at Winterbourne. We didn't see people with the right values and the right attitudes. So I think that's absolutely fundamental, and I think the opportunity to the right healthcare is people should get that the same whether they're in hospital or assessment treatments or wherever they are.
I have to disagree when you said is that the people in them homes, in them places, know their rights when they don't. Because I've done a lot of inspections, and when you're asking a person, do they understand their rights, when you haven't got a clue what rights mean. And to me, is that we keep going on about Winterbourne, that when we get Winterbourne sorted out, things are going to get changed. McIntyre showed a place a couple of years ago on the television where people were getting abused. Cornwall was a big thing where people were getting abused. Maitland Sutton in London, but they brought the Healthcare Commission in themselves to sort things out. I just want to know, is when do we say enough is enough? Because it's like you say about people's rights. We've got to get money back into self-advocacy groups because that's where things will change. I'll be honest with you, don't depend on the police, don't depend on other people. It's you guys who make a difference. Because by you being inspectors and going into these places, it's down to you things are changing. And not the police and that. Because they don't know how to deal with people like us. Because to them, not just them, to others, we're like aliens. They don't know how to work with people with learning disabilities. And it's down to us to teach them. Because if we don't teach them, and we don't start speaking out, right now, while we're doing this, someone's being abused. And we turn around and go, it's only happening in these hospitals and these units. Well, I'm sorry, but it's not. It's happening to people who come out of these places living in the community. And it's going to be down to us, guys, to stop this. Because if we're going to depend on the government, everyone, it's not going to happen.
Actually, I agree with an awful lot of that because people need support, don't they, in these sorts of situations, and they do sometimes need somebody to speak out for them. So there is a real point about how do you get the voice of somebody heard. And you know, I'm a strong advocate for families and friends being involved in people's placements in other places, because they can really help to make that whatever they're experiencing more visible. I suppose from my perspective, one of the things is I actually think it's about making sure that we only use these sorts of facilities for the right reasons, because it's quite clear that more people have been in these sorts of settings than there needs to be. And one of the things from Salford that I've learnt is that we don't have very many people in these settings, and we wouldn't want to use them unless it's absolutely the right thing, and that's only in a very small number of occasions. I suppose the other bit is we've got to take some responsibility for making sure that we don't forget that people are there, and actually look to review and check what's happening for people, because the other thing that's clear is that people have stayed in those sorts of settings for too long. And if we're not reviewing them, we can't check whether or not the health needs or the other needs that people require are actually the right kind of things for them. And I suppose the last thing I'd say is just trying to make sure that they're the right kind of quality in the first place, because if you do need that sort of facility, it's got to do the right things for you.
Thanks. I think for me the question was, what are we going to do to make sure that people do get the healthcare that they need when they're in a specialist hospital or an assessment and treatment unit? Something that most of the commissioners in the room will have been involved recently in is the care and treatment review process. I think this has really opened all of our eyes. I think it's been a really powerful process, and it showed us that when you take in a social worker, a nurse, a commissioner, an independent visitor, an independent clinician, a whole host of people, and actually examine and scrutinise the quality of care that somebody receives, you get a completely different reaction from a provider. You're able to scrutinise that provider's records and hold them to account if they haven't given somebody the medical interventions or treatment that you should have given them. If you've recorded in their notes that they've had stomach pain 10 times, but they haven't been to the GP, the nurse, a specialist health professional, asks the right questions. The commissioner in the room can say, well, hang on, we pay you a lot of money to give a good service and you're not giving us one. Things start to change. So I think we'll see an awful lot more reviews that look like care and treatment reviews in the future, and I think they will improve the quality of care that people get. Thanks.
Okay, well, I was Connor Sparrowhawk's dad, and he didn't have any healthcare issues apart from his sectioning and being put in an ATU. He had epilepsy, which that unit denied he had, refused to treat his epilepsy, and he subsequently died following a seizure in the bath. The commissioners had done a report on that unit and not followed up. A member from the post-Winterbourne review had been in there and not followed it up. I'm really disappointed that things I hear over and over again from professionals, it's about process, it's about long-term working together. It's not. It's about fundamental human rights for all individuals to be protected and entitled to the life that we all are. And until such time as that culture is accepted by the National Health Service, commissioners and everybody else, this will keep happening. There are not enough sanctions, not enough punishment, and not enough people are held to account for what happens in these units and to people with learning disabilities, and it has to stop, and it has to stop now.